So we are continuing with the topic on the advantages of corticobasal implants. Thank you, Dr. Rupesh, for being with us during this video shoot.
It's a pleasure.
So it's always a pleasure. So now we come to the next point. It is highly successful in compromised cases. Now, what are the compromised situations? There are so many situations where you cannot offer conventional implants. For example, in diabetic patients, where poorly managed diabetics can impair healing and increase the risk of infection after surgery. So very often what happens, once you've placed the implant, the corticobasal implant, and it is integrated well, then a variation in the sugar levels will not affect the implant.
Okay.
Whereas that is not the case with conventional. In conventional, what happens if there is a huge variation in the sugar levels, that can always predispose to infections around the implants. So, which is a huge advantage. In smokers, generally smokers are contraindications.
Correct. Yes.
Smokers, conventional implants are contraindicated. Why? Because in smokers, what happens? The gums recede. And the moment the gums recede, automatically the bone gets infected, and the bone around the implant gets infected, and then the whole thing fails. This is what happens. But in corticobasal, what is happening? The anchorage is deep down in bone, in the rock below, in the cortical bone, and therefore there is no question of the recession of bone affecting the stability of the implant. That is a beauty in smokers.
Then again, once again, we need to give you a disclaimer that Dr. Prasanth in no way is encouraging smoking. And the smokers need not feel very happy about
Absolutely.
about thinking that okay, I
Yes.
can do this and smoke. So kindly don't.
I always tell my patients, but that does not give you a license to smoke.
Absolutely. So
because smoking anyway is detrimental.
it is absolutely detrimental. So
it is definitely going to create a problem. So I will never encourage smoking. But even in smokers, this works well. That is all what I had to say. But I always discourage my patients from smoking after the procedure. I say, no, don't smoke. And another very important thing is, smoking is definitely a contraindication during the immediate postoperative phase.
Absolutely. So
because the soft tissue healing will be affected. Yes.
Yeah. So I know smokers, kindly stay away from smoking.
Yeah. Certainly. In immunocompromised individuals, where patients have got immune compromises, even in such situations, very often conventional implants are not indicated, but corticobasal works well because it is anchored in the cortical bone. Patients with severe periodontal disease, I have already shown you many cases, and I will be showing you a few more cases on with in cases of severe periodontal disease. Corticobasal implants works wonders without any bone graft, nothing. In heavy alcohol consumers, this works well. In osteoporotic patients, it works well. There is no problem. Now, coming to that heavy alcohol consumer, it doesn't mean that you can go drink all the time. It is going to hit your liver and all the other organ systems. So I will never support drinkers, but alcoholics. I will not support alcoholics, but I just wanted to highlight this fact. And osteoporotic patients also, if you anchor it in the right bone and if we load the implants in the right manner, the corticobasal implants work very well. Patients on bisphosphonate therapy, yes, bisphosphonate therapy is a contraindication for dental implants. But in the case of corticobasal, you have an advantage that it is not affected by the bone remodeling process, which is not the case with conventional. In conventional, the bone remodeling is very high, but here the bone remodeling is low. However, we always say that people who are on bisphosphonates, they have to undergo certain blood tests to confirm that the detrimental effects of the bisphosphonate therapy are not present while the implant procedures are underway.
Okay.
Which is very important. And excessive bone loss scenarios like road traffic accidents, congenital defects, And in debilitating conditions such as mucormycosis, these implants work superb. That is another huge advantage. And patients indicated for bone grafting, all these people, they have advantages in getting the corticobasal implants done. So there are huge advantages, and I will just show you a scenario where severe periodontal disease cases we are able to treat with corticobasal. We are just showing you this. It manifests as bleeding gums and mobile teeth, bad breath, and all that. In situations such as these, you have to go for very often you have to go for bone grafting before you place implants, and very often patients have to be without teeth for quite some time. But you can see this patient came in from the US in 2013. He told me that he spent thousands of dollars on this particular bridge, and we extracted all those teeth in one go, and we finished the case. And this is the picture, 2 years post-operative picture, and this is the 10 years post-operative picture. In 2023, when he came, you can see how beautifully the bone is resolved around the implants. He's doing great. And that is his pre-operative, and this is his post-operative image. You can see the difference. This is the 10 years post-operative. Please remember, this is the pre-operative. So he's doing great. And there are situations where bone loss happens after extractions. In such situations, you can avoid bone grafting and place implants, which is a huge advantage. In congenital defects, now this boy came to me with missing laterals. He had very severe bone loss in the lateral area, and in the normal course, they will have to do bone grafting, but we place the implants without grafting. This is a compression implant where it has actually separated, while we place the implant, it just pushed the lingual and expanded the cortex. Yes, it just pushed the lingual and buccal cortex apart, and it's a compressive implant. And this case is more than 7 or 8 years now. He's doing very well. You can see this. And the result, the aesthetic result is also very good. Then the other scenario, a very common thing which we encounter is the maxillary sinus. A low-lying maxillary sinus is always a contraindication for dental implants.
Right.
So they have to do sinus lifts, do bone grafting, and you have to wait for at least 6 months before the implant is placed, and then another 3 to 6 months before the crown is placed. And you can see in this picture, you can see how a low-lying sinus has been grafted and the implants are placed, and then after that they place the crowns after a few months. But you can see a very similar case of ours. You can see what we've done. These teeth were very much compromised, so we managed to place implants bypassing the sinus walls, and we could complete the case. So this is how we bypass the maxillary sinus, by anchoring in the good quality bone which is available around, but at the same time we are able to replace the teeth in a very fast way.
Right.
Which is a huge advantage. And as I mentioned earlier, during one of my earlier videos, there's no question of bone grafting being employed. There are different types of grafts being used in dental implantology. You have autografts, which are basically the patient's own bone. The bone is harvested from the mandible, from the chin, from hip, from the tibia. So all this bone is used for grafting. And allografts, which are again human donor bone from cadavers, or it may be processed bone. You have xenografts, which is basically animal bone, bovine or porcine, and alloplastic materials like hydroxyapatite, bioactive glass, etc. All these are used as bone grafts, bone graft substitutes. You have growth factors such as PRP and all that. Then you have composite grafts, which are also used, which is a combination of many of these grafts.
Right.
So all this can be avoided in when we use corticobasal implants. So here is a list of situations where you need to do grafting and what are the techniques of grafting being employed. I don't think it is necessary for me to explain all this, because it will work out to be like a dental school class, so which I don't want to, but those of you who are interested can go
But besides you being practicing corticobasal,
yes,
it doesn't matter.
It doesn't matter. It is irrelevant. It is irrelevant. So I have already explained all this, and all the techniques I have explained. And there are lots of problems also which are associated with bone grafting, such as infection, graft failure, rejection of graft, pain and swelling, nerve damage, prolonged healing time, a host of things which I have shown in the table here. All this can be avoided.
Right.
All this can
Dr.
be
Prasanth,
avoided.
since we have gone through a list of compromise situations, how about immediate loading? Suppose a patient comes to you on an extraction socket. Suppose a patient is undergoing an immediate extraction. So in such situations,
such situations also, we can definitely soon after the extraction, we can place the implant immediately and fix the tooth immediately.
So
the only point which should be kept in mind is that it will take a year or a year and a half for the bone to heal and settle around the implants. So generally in my practice, the first set of crowns which I provide for the patient is interim, and then after a year or year and a half, I change that to a permanent crown, by when the bone and the soft tissues would have healed and settled.
Right.
This is what we do. And most of the work is done under local anesthesia. There's no question of general anesthesia.
I think I've
already mentioned. Generally, what happens when zygomatic implants are placed, very often in conventional implantology, you need general anesthesia, but here we are able to do this under local anesthesia and all keyhole techniques. And even when there is extensive bone loss, alveolar bone loss, like following road traffic accidents, a case like this, we have placed implants and we've restored with fixed teeth soon after the initial healing is over. So, which is a huge advantage. So, there is no question of grafting there, but we are able to provide a solution for the patient. So, these are the advantages of corticobasal implants.
So, again, we talked extensively about the advantages of this particular system.
Yes.
Dr. Prasanth being practicing it for almost a couple of decades now on the corticobasal system. But Dr. Prasanth, when we speak about advantages,
you need to talk about the disadvantages also.
Absolutely.
Okay.
So, are there any in your practice have you come across?
The disadvantages, I would say, is this science cannot be learned and practiced that easily. You need to really undergo a lot of training, and you need to have the infrastructure like the attached lab. You need to have the attached imaging facilities like the OPG CBCT facility, about which we will have another discussion on another date. All the diagnostic protocols which we follow. So all this facility should be there, and you should also be trained to do these implants. The techniques are different, the armamentarium is different, the protocols are different, everything is different. So the learning curve is quite steep. This is one disadvantage from the point of view of a doctor.
What about the technique sensitivity? Is there any technical difficulties?
Technical difficulties are also there. You need to be really trained to do this, which is very important. Whereas in conventional implants, the advantage is you are able to plan the case well beforehand with the help of stereolithographic models and surgical guides and all that, and then you do it. So everything goes in a planned fashion, but here it is not very often. It doesn't work that way. You have to identify the bone, the good quality bone, anchor it in the good quality bone, which means you need to have a thorough knowledge of the anatomy, and you also have to be trained to avoid complications just in case a problem is to arise. So, which is another very, very important aspect.
Okay. Thank you, Dr. Prasanth.
Thank you very much. I hope you like this video of ours on corticobasal implants. And please like the video, please subscribe to our channel, and do share the video with your friends. Thank you very much. Thank you, Dr. Rupesh, for
Thank
being
you.
with us
Thank
again.
you.
Thank you.